My name is Dr. Jeff McAlister. I practice in Phoenix, Arizona at the Core Institute. Today we're going to be demonstrating a Talo-Navicular joint fusion with the EasyClip Xpress staple. Now we're going to demonstrate our Talo-Navicular joint fusion with 20mm EasyClip Xpress staples. Typically what comes in this set is a nice distractor. This is going to be our adjustable distractor. We're able to distract the staple to the appropriate parallel position and insert it. This is our EasyClip Xpress. We're going to demonstrate a Talo-Navicular joint fusion with 20mm staples. This here in the kit is going to be our drill sleeve. This is one 3.0mm drill, which is going to be used for drilling the appropriate holes. After drilling, we're going to use these positioning pins here to hold stable our drill guide. After this is done and our staples inserted, we can easily remove this head, place it on the back table, and insert our impactor. Again, today we're going to demonstrate a Talo-Navicular joint fusion with EasyClip Xpress staples. Typically, I will use a dorsal approach. This is going to give me good visualization of our Talo-Navicular joint. We're able to resect our cartilage from a medial approach here, resect that medial pole, and also resect our lateral Talo-Navicular joint to really prevent some of those non-unions. The great thing about 2 points of fixation here is that we can get nice medial, dorsal-medial fixation and dorsal-lateral fixation. I've already temporarily pinned our Talo-Navicular joint for temporary fixation. We can also visualize to make sure we're not in the NC joint or tibiotalar joint. I like to give a little bit of visualization of the articular surface of the ankle, which gives me confirmation that we are in the Talo-Navicular joint. After we've positioned it appropriately and pinned it with a temporary guide wire, I will then use the drill guide, which is offset approximately 5 to 10 degrees, as you can see here. Once I get my position appropriately aligned, I will then use a 3mm drill, followed by a positioning pin. Now, of note, this does not have a positive stop. Our positioning pin is then inserted to allow for perfect parallel fixation of our staple. This will obviously be confirmed on radiograph to confirm we are not in our navicular cuneiform joint or tibiotalar joint. At this point, we know exactly where our staple is going to be inserted. We have our positioning pins readily available. We're next going to use our adjustable forceps to insert our staple. After we have our positioning pins in place, they're nice and parallel, we're going to remove one, usually the most proximal and most visible. We're next going to use our adjustable forceps to really create a nice parallel arms for our staple here. We're going to insert this here in our proximal hole and then use our positioning pin for visualization of our other arm for our staple. Once this goes in almost halfway, we can then remove the adjustable forceps. We can see here our staple is halfway in. We can then use our impactor and a mallet to appropriately guide our staple into our positioning holes and allow for final fixation. So again, that is our dorsal medial point of fixation. Next, we'll insert a dorsal lateral. I typically will use 2 points of fixation here, as I mentioned previously. The 20mm EasyClip Xpress staples are typically the most robust with one of the thickest arms and really reduces that non-union risk. At this point, again, we'll do the same thing, repeat our steps. Drill, 3mm drill, positioning pin, making sure we're not in our navicular cuneiform joint, positioning pin here, remove this drill guide. Again, now we can see our positioning pins. Next, we'll get our staple and impactor ready. Our adjustable forceps are again used for paralleling our staple arms. Proximal positioning pin removed. I can clearly visualize our proximal hole here. I know exactly where that distal hole is going to be. With slight retraction, I can visualize where our staple is going to go in. The adjustable forceps are removed with ease. Our impactor is going to be used for final fixation. So 2 points of fixation, talo-navicular joint. Our temporary guide wire is then removed. Now you can see our final points of fixation for our talo-navicular joint. If you do find that your staples sit slightly proud, you can use your impactor again to mallet down the corners, not leaving them too proud, of course. This is typically visualized under C-arm to confirm final placement.